Yes. This is Dementia by T18. We have Lai Pinhui Glenn, Josephine Tiong Ziqi, Jasmine Loh, Liu Yixing, and Putri. So this is our table of contents. Firstly, we have the etiology for dementia. And secondly, we have the causes of dementia. Thirdly, we also have the prevalence of dementia in Singapore. Fourth, we have the assessments and investigations regarding dementia. Fifth, symptoms and characteristics of dementia. And lastly, we have the strategies and interventions.
So what is dementia? Dementia is a general term that represents a group of diseases and illness that affect your thinking, memory, reasoning, personality, mood, and behavior. The decline in mental function interferes with your daily life and activities. It is estimated that about 50% of people aged 85 and older have dementia. Current medications may help slow the mental decline.
Etiology for dementia, Alzheimer's disease. It occurs due to abnormal buildup of protein known as tau tangles and amyloid plaques that damage the health neuron like the brain cells. Vascular dementia. It occurs due to damage in the blood vessel, resulting in reduced blood supply to the brain. Frontotemporal dementia. This uncommon form of dementia usually occurs in people younger than 60 years old. It occurs due to build-up of abnormal amount of certain protein in the brain. Prevalence of dementia in Singapore. 1 in 11 individuals aged 60 and above live with dementia. This percentage increases with age, with a staggering 1 in 2 persons aged 85 and above diagnosed with dementia. The risk factor of dementia, age. Although age increases risk, dementia is not a normal part of aging, and aging is not itself a cause of dementia. Genetics. The gene APOE was the first known to increase a person's risk of developing Alzheimer's disease, which is the most common cause of dementia, and it is currently still a stronger risk gene known. Ethnicity. In a 2008 study investigating the prevalence of dementia in Singapore, Malays was found to have twice the risk of developing Alzheimer's disease than Chinese, while Indians has more than twice the risk of developing Alzheimer's disease and vascular disease than the Chinese.
Symptoms of dementia. Cognitive symptoms. People with dementia often show memorized loss and confusion about time, place, or people. Behavioral symptoms. Mood swings, irritability, or loss of interest in daily life are common. Functional symptoms. Patients gradually lose the ability to manage daily tasks and self-care.
Next, we have the characteristics of dementia. Firstly, we have aphasia, which affects the production or comprehension of speech and the ability to read or write. Secondly, we have apraxia, the inability to perform purposeful action, although motor and sensory abilities are intact. Thirdly, we have agnosia, the inability to interpret or recognize common objects or faces of familiar people despite intact sensory abilities. Lastly, we have executive dysfunction, the problems in planning, reasoning, organizing, or problem solving. This is an example of the characteristic of agnosia, where the elderly patient does not recognize their caregiver.
Next, we have the initiative to manage dementia in Singapore. The first one, National Dementia Strategy, NDS, was launched in 2009 and updated in 2017. Guides by MOH and partners in improving dementia care and caregiver support. Second, Forget Us Not Dementia Care Initiative, a nationwide independent campaign led by Lian Foundation, Khoo Teck Puat Hospital, and Alzheimer's Disease Association. Third, Dementia Friendly Singapore, DFS. In 2016, the Ministry of Health (MOH) introduced a national initiative aimed at tackling the growing prevalence of dementia in Singapore. About National Dementia Strategy (NDS), objective: raise awareness and promote early detection through national campaigns and screening. So, how NDS works? The Community Outreach Team, MOH and AIC, work with community partners to reach out to seniors showing signs of dementia and refer them for assessment. For example, they have successfully engaged amount of 324,000 of seniors across 48 teams. About the features of National Dementia Strategy, the affordable care support teams, like government subsidized, support affordability with Singaporeans receiving up to 80% of subsidy in subsidized hospital wards.
Next, we have the Forget Us Not Dementia Care Initiative. Firstly, the objective of the initiative is to increase awareness of the rising number of people living with dementia and their specific needs, with the aim of creating a community of care in which the condition is normalized and recognized as a disability. How the Forget Us Not Dementia Care Initiative works. The staff at Kutekpot Hospital will conduct tailored dementia-friendly training for an organization's team, using interactive methods like role-playing. The features of Forget Us Not Dementia Care Initiative is that the members of public can enroll to become a dementia friend, gaining access to information on recognizing dementia symptoms and how to engage with people living with dementia. Next, we have the Dementia Friendly Singapore, DFS. The objective of this initiative is to create communities and a nation that are dementia friendly and supportive of people living with dementia, guided by the 3 E's approach: engage, empower, and enable. The intended results are to encourage preventive measures, promote early detection, and ensure care and support are provided. How the Dementia Friendly Singapore works. Members of the public may bring individuals living with dementia who appear disoriented and unable to find their way home to the staff for assistance. Features of DFS. Bright yellow circles resembling buoys were placed throughout the neighborhood to help persons living with dementia navigate, guiding them to key spots like the local market. Next, I'll pass the time over to Putri. Yusing.
Future plans for dementia community education. Campaigns to reduce stigma and increase understanding, caregiver support and training providing knowledge and emotional support to family members. A tripartite collaboration among MOH, AIC, and community organizations to stress care networks. AI-assisted detection, AI-assisted diagnosis and monitoring using artificial intelligence to detect cognitive delay early. Agency for integrated care and co-position a healthcare agency under Singapore's Ministry of Health, focused on coordinating community-based and long-term care services to support seniors in aging gracefully. Key functions is service connection, home care, meal delivery, personal care, daycare centers, and nursing homes. Resource integration, linking hospitals, community providers, and volunteers. Caregiver support, training, respite care, financial aids. Key initiatives and Sliver Generation Office engage volunteers to assist with care, police, and emotional support.
미니멘트 A mental status assessment is a systemic evaluation of a person's cognitive, emotional, and behavioral functioning, including the abbreviated mental test (AMT) and more specific tools like mini mental state examination (MMSE), is to identify and monitor the individual progress of cognitive deterioration. The next one is about mini mental state examination (MMSE). It is a set of 11 questions. It's used for tracking changes in cognitive status over time and evaluate key mental abilities like memory, attention, and language. And it's also to assist in diagnosing cognitive disorder such as Alzheimer's disease, scoring from 0 to 13, and above 24 indicating a normal cognitive function. The next one is example question on MMSE. The next one is abbreviated mental test (AMT). It consists of 10 questions. It's a quick screening tool to assess cognitive function, especially in elderly patients. It's also to detect confusion or cognitive impairment. It's also to identify potential problems like dementia or delirium. It's also is scoring from 0 to 10. Above 6 point is indicating normal cognitive function. And this is an example questions on AMT. And the next one is nursing intervention. First, maintain a safe environment. Dementia patients are at risk of fall, injury, or wandering. And we need to removing hazard using bed or chair alarms and ensuring adequate lighting to prevent accident. The second one is encourage a structured routine. A regular daily routine reduce patients' confusion, anxiety, and agitation caused by memory loss or disorientation. The next one is monitor behavioral and psychological symptoms because early reconnection can help in managing patient symptoms with non-pharmacological methods and prevent harms to self or others. And the next one is educate and support family or caregiver. This can help increase caregiver understanding of dementia progression, coping strategies, and how to manage behavioral changes. And the next one is provide emotional support and reassurance to the patient because this can help reduce anxiety and build trust between nurse and patient. Also help patient feel emotionally safe and are more likely to cooperate during care activities. And the last one is the nurses can assess patients' cognitive function and memory, use cognitive assessment tools such as MMSE, mini mental state exam or AMT, abbreviated mental test, can be used to determine the patient's cognitive function.
So in conclusion, firstly, we have explored the many different causes, symptoms, and interventions for dementia patients. Secondly, this can help with the early detection of symptoms of dementia and slow down its progression, delaying the onset of more severe stages. Thirdly, by starting interventions early, we can reduce the harm caused to the patient themselves and their loved ones from dementia. Thank you. These are all our references.